I will be discussing Sulindac, a medication belonging to the nonsteroidal anti-inflammatory drug group. This drug is widely prescribed for pain and inflammation. I will explain its generic name, class, brand name, definition, mechanism of action, uses, indications, contraindications, precautions, dosage, what to do in case of a misdose or overdose, when to stop taking it, its side effects, vital information, and drug interactions. 1. Generic name, drug class, and brand name. Generic name, Sulindac. Drug class, it belongs to the class of nonsteroidal anti-inflammatory drugs, or NSAIDs. More specifically, it is an indene derivative and a prodrug. Brand names, it is commonly marketed under the brand name Clinoral, although generic versions are available. 2. Definition. Sulindac is a prescription medication used to reduce pain, swelling, stiffness, and fever. Like other NSAIDs, it works by interfering with the production of chemicals in the body that cause inflammation. What makes Sulindac somewhat unique is that it is a prodrug, meaning it needs to be metabolized in the body to become active. 3. Mechanism of action. When you swallow Sulindac, the drug itself is not active. In the liver, it is converted into its active metabolite called sulfide. This active form inhibits cyclooxygenase enzymes COX-1 and COX-2. These enzymes normally produce prostaglandins, which are responsible for pain, swelling, fever, and protection of the stomach lining. By blocking prostaglandin synthesis, Sulindac reduces inflammation, lowers pain, and brings down fever. However, because prostaglandins also protect the stomach and kidneys, blocking them can cause side effects. 4. Uses Sulindac is primarily used in rheumatoid arthritis to control joint inflammation and pain, osteoarthritis for reducing stiffness and swelling, ankylosing spondylitis, a condition affecting the spine, acute gouty arthritis, short-term treatment during gout attacks. It is also sometimes prescribed for tendinitis and bursitis. Indications. Doctors prescribe Sulindac when patients have chronic inflammatory diseases such as arthritis. Patients experience acute painful episodes like gout attacks. They require an NSAID but may not tolerate others. Sulindac has been shown to sometimes cause fewer kidney side effects compared to indomethacin. Hab 6. Contraindications. Sulindac should be avoided in patients with known allergy to NSAIDs or aspirin, those with a history of stomach ulcers, gastrointestinal bleeding, or perforation, people with severe kidney disease, liver failure, or advanced heart failure, patients with aspirin-sensitive asthma, pregnant women, especially in the third trimester, as it may cause complications like premature closure of the fetal ductus arteriosus. 7. Precautions before taking this medicine. Inform your doctor if you have high blood pressure, heart disease, kidney problems, or liver impairment. Be cautious if you are elderly, because older patients are at higher risk for GI bleeding. Avoid alcohol and smoking, as these increase stomach ulcer risk. Discuss with your doctor if you are taking blood thinners, steroids, or other NSAIDs. Pregnant or breastfeeding women should consult their physician before use. 8. How to use. Sulindac is taken orally with food to minimize stomach upset. It should be swallowed whole with a full glass of water. It is usually prescribed to be taken twice daily, around the same time each day. Patients should not lie down immediately after taking it to reduce reflux risk. 9. Dosing information. For osteoarthritis, rheumatoid arthritis, and ankylosing spondylitis, 150 milligrams twice daily, maximum 400 milligrams per day. For acute gouty arthritis, 200 milligrams twice daily. Dose adjustments may be needed in patients with kidney or liver impairment. Missed dose and overdose. Missed dose, take as soon as remembered unless it is nearly time for the next scheduled dose. Never double the dose. Overdose symptoms. Severe abdominal pain, nausea, vomiting blood, black tarry stools, confusion, drowsiness, difficulty breathing, kidney failure. Overdose requires emergency medical attention. Chash 11. Stop or avoid taking. Stop taking Sulindac immediately and consult a doctor if you experience severe stomach pain, vomiting blood, or black stools, swelling of the face, lips, or throat, allergic reaction, chest pain, shortness of breath, sudden weakness, possible heart attack or stroke, yellowing of the eyes or skin, liver damage, unusual fatigue or changes in urination, kidney problems. 12. Side effects. Common side effects include nausea, diarrhea, indigestion, stomach pain, dizziness, headache, rash or itching. Serious side effects include stomach ulcers, bleeding, or perforation, increased blood pressure, heart attack or stroke, especially with long-term use, kidney failure, liver toxicity. 13. Vital information. Like other NSAIDs, Sulindac carries a boxed warning about increased risk of serious cardiovascular events such as heart attack and stroke. It also carries a warning about serious gastrointestinal bleeding and ulceration, which may occur without warning, especially in older patients. Therefore, it should always be used at the lowest effective dose for the shortest possible duration. Have 14 drug interactions. Sulindac can interact with many drugs. Anticoagulants like warfarin increase bleeding risk. Other NSAIDs or aspirin additive GI damage. Diuretics and ACE inhibitors may reduce kidney function. Lithium increases lithium levels, risk of toxicity. Methotrexate increases risk of toxicity. Corticosteroids, higher risk of stomach ulcers. Conclusion. To conclude, Sulindac is an important NSAID that helps manage pain, swelling, and inflammation in conditions like arthritis and gout. It works by inhibiting prostaglandin synthesis, but must be used cautiously due to risks of gastrointestinal bleeding, kidney injury, liver toxicity, and cardiovascular events. Patients should always follow medical advice, avoid risky drug combinations, and monitor for warning signs. When used appropriately, Sulindac can significantly improve quality of life in patients suffering from painful inflammatory conditions. Thank you. Have a nice day.